Hello students, today we will discuss preoperative evaluation of hepatic disorders. The liver disease can affect hepatocytes and biliary system or both. Liver disease affect protein synthesis including coagulation factors and albumin. It also affects drug and toxin metabolism and bile regulation. The hepatocellular disease including viral, alcoholic, autoimmune hepatitis or hepatocellular carcinoma affects hepatocyte and synthetic function of the liver. Obstructive disorders include choledocholitis and bile duct tumors. The bile duct tumors are extrahepatic. Then primary biliary cirrhosis is intrahepatic or primary sclerosing cholangitis, that is extrahepatic and intrahepatic, causes bile stasis. Most of the drug induced liver disease and some form of viral hepatitis affect both hepatocyte and biliary system. Now we will see about hepatitis. The hepatitis is in term used to describe inflammation of the hepatocytes. It can be caused by drugs, alcohol, viruses. The example of viruses are hepatitis A, B, C, D and E. It can be autoimmune disease also. All of these conditions have acute or chronic phases that can progress to cirrhosis, which is irreversible fibrosis of the liver. The risk factors for hepatitis are alcohol use, sexual activity, that is multiple partners, then intravenous drug use, blood transfusions before 1992, travel to underdeveloped countries, obesity, tattoo and body piercing. These are the causes. Then we will say about hepatitis A. The hepatitis A is caused by contaminated food or water or contact with infected person, and rarely it progresses beyond the acute illness. A remote history of hepatitis A has no significance preoperatively. Now we will see hepatitis B. Hepatitis B is transmitted by sexual activity or contact with blood, rarely from the transfusions since screening has been implemented in 1986. It varies in severity but is much less common since widespread use of vaccination against the virus. Then we will say about hepatitis C. Hepatitis C is caused primarily by blood exposure. Blood has been screened since 1992. Most of the intravenous drug users, many patients are unaware of infection because of acute phase is frequently asymptomatic, but it can advance to cirrhosis. Now we will see hepatitis D. Hepatitis D occurs only with hepatitis B and hepatitis E and is rare in developed countries. Then alcoholic hepatitis. Alcoholic hepatitis generally occurs after at least 10 years of daily moderate to heavy alcohol intake. That means more than 3 drinks per day for women and more than 5 drinks per day for men, and may progress to cirrhosis. Next, autoimmune hepatitis. Autoimmune hepatitis primarily affects young women and has no known cause. Virtually any drug as well as herbals or over-the-counter preparation can cause hepatitis. These drugs include statin, isoniazid, acetaminophen. Now we will see about obstructive jaundice. The extrahepatic bile duct obstruction is caused by gallstones, by tumors. The tumors of pancreatic, gallbladder, bile duct, ampulla fiter or scarring. The patients may have jaundice, pruritus and abdominal pain. The predictors of surgical mortality are preoperative hematocrit less than 30%, bilirubin concentration greater than 11 mg%, malignancy, and the death may occur in as many as 60% if all three are present. The renal failure develops in 8% of the patients post-operatively, which may be lessened by administration of bile salts and lactulose. This is about obstructive jaundice. Now we will see miscellaneous liver diseases. The Wilson disease, hemochromatosis, and alpha-1 antitrypsin deficiency are less common than the hepatitis. They are hereditary and commonly occur in the members of the same family. The obesity can result in non-alcoholic steatohepatitis. It is also known as fatty liver, which can cause abnormal LFTs as LFT results, and it can progress to fibrosis. Then primary biliary cirrhosis is an autoimmune disorder that results in intrahepatic biliary obstruction. It occurs most frequently in middle-aged women and is associated with antimitochondrial antibodies. Then primary sclerosing cholangitis destroys bile duct, is most frequently in young males. It is associated with inflammatory bowel disease but can be idiopathic, and it may progress to cirrhosis. The acute illness such as sepsis, surgery, anesthesia can cause hepatic dysfunction. Thank you.